بسم الله الرحمن الرحيم. اللهم صل على محمد وآل محمد. أبناء الطلبة، المحاضرة اليوم إن شاء الله تكون كل سهلة، وأنا حاولت أختصرها بالشي المهم جدا إلكم، وسويتها على جزئين حتى تكون أسهل لكم، وحتى تكون أيضا بالداونلود أسهل. فأرجو أن تكون يعني محاضرة جيدة بالنسبة لكم. أحب أبدي يعني anatomical consideration in a simple way. مثل ما تعرفون إنه layers of the scrotum from the outside is the skin, then the dartus muscle, then the external spermatic fascia, then cremasteric fascia, then internal spermatic fascia, and then the tunica vaginalis with two layers. The outer layer is parietal and the inner layer is visceral. Then the tunica albuginea in direct contact with the testicle. Here is the testicle, and here is the head, body, tail of the epididymis, and then is the cord. So this is in a simple way. حرصت انه تكون بالمحاضرة يعني معلومات تفيدكم ب يعني حياتكم العملية اكثر مما هي يعني نظريا. فانتوا راح تشوفون بالطوارئ مرضى، وحسب خبرتنا مرضى اللي يعانون من السكروتال swelling، وعندنا two main entities: painful and painless scrotal swelling. And what will you do? To start with, أريدكم تعرفون what are the causes of painful scrotal swelling and what are the causes of painless scrotal swelling. Here, look for this man, he has a severe pain in the testes. One of these causes is testicular torsion. And look, the torsion might occur either intravaginal, يعني within the tunica vaginalis, or extravaginal، يعني tunica vaginalis ويا التويست، يعني يصير tunica vaginalis يعني التورشن يصير outside the tunica vaginalis. That's why it's called extravaginal. هنا المريض يجي severe pain, agonizing pain, nausea, vomiting, radiation into the abdomen, into the groin. طبعا المريض هنا يا اما child يا اما adolescent. هنا طبعا هنا is an emergency، ولازم تتصرف within 6 hours، والا المريض يفقد شنو؟ التستس مالته. هنا another less common entity is the torsion of the appendix of the testis. هنا المشكلة إذا صارت وصار gangrene هنا ماكو مشكلة، بس إذا صار هنا gangrene patient will lose the testis. هنا important sign هو blue dot sign، فالنقطة زرقاء على scrotal skin. Other causes مال painful scrotal swelling هو epididymitis, orchitis, and here you know that for example it occurs in adolescent, UTI, or those with unprotected sexual intercourse, or in children after mumps orchitis. Trauma might cause pain, hematoma. This will result in pain. Also, if the patient has a complicated hernia, obstructed hernia, he might have pain also. What are the causes of painless scrotal swelling? Here is the hydrocele, and we have many types of hydrocele, either non-communicating or communicating hydrocele. Varicocele, we have 3 grades of varicocele. Grade 1 is palpable on Valsalva maneuver. Grade 2, palpable and visible, palpable without Valsalva maneuver. And grade 3 is visible. And here usually is painless, but sometimes in huge varicocele in grade 3 you can feel it as a bag of foam, like here is visible, and there might be a dragging pain، فدي يحس ثقل بالخصية. هنا الهرنية Hernia, if it is uncomplicated, look for this loop of the intestine reaching the scrotum. هذه إذا ماكو obstructions painless. Spermatocele, look for this cystic lesion at the upper pole of the testis, which thought to be originated from ratty testis, is also painless. Testicular cancer, most of the time, is painless unless there is complication, like for example hemorrhage, or yeah, this might result in pain in about 20% of the patient. Heart failure, there might be a leg oedema with scrotal oedema or anasarca generalized oedema. Other uncommon causes of scrotal swelling, like and pain, is idiopathic scrotal edema in children, syphilitic gamma of the testes, tuberculosis of the testes, peritoneal dialysis, ventriculoperitoneal shunt with pooling of fluid into the scrotum, Henoch-Schönlein purpura, pancreatitis, hidradenitis suppurativa, congenital abnormalities like Milroy's disease, which is congenital abnormality of lymphatic vessels. We come back to the scenario. What we have to ask in those patients with scrotal swelling? First of all, in the history, you have to ask the patient about the age, the marital status, occupation, pain, which is very important. Whether it is present or not, you have to ask about the onset, severity, radiation, nausea and vomiting, fever, low grade or high grade fever and rigor. There might be those with prostatitis and epididymitis, acute prostatitis and acute epididymolysis. There might be a fever with high grade fever. Size, whether it is gradually increasing in size or sudden with abrupt increment in size. Trauma, strenuous sexual intercourse, unprotected illegal sex relation. Patient might have lifting a heavy weight, chronic cough or constipation. These are predisposing factors for hernia, abdominal or back pain, cough, hemoptysis, dyspnea if you suspect tumor. On examination, we have the most important thing in the examination is privacy, and you have to discuss what you are going to do with the patient. And you have to local examination and abdominal examination, left supraclavicular lymph node, and chest examination. And the scrotal examination or genital examination should be conducted in standing position, exposure from the waist with, as I said, privacy, and then you have to do inspection for the color of the skin, a side of the swelling, whether unilateral, bilateral, any discharging sinuses, positive cough impulse, and any visible masses in the inguinal region. Then you have to do palpation. The most important thing is whether you can get above the swelling or not. If you can get above the swelling, then you proceed with scrotal examination. If you cannot, then you have to ask the patient to reduce the hernia and then to do a visible and palpable cuff impulse. Then you have to do a systematic examination and palpation of the testis, epididymis, head, body, tail, and the vas and the pampiniform plexus. And if there is a swelling and you suspect hydrocele, then translumination. then abdominal examination. أتذكر شفت مريض كان يعاني من يعني testicular tumor وسووا له اوركيدكتومي radical اوركيدكتومي. اجى ورا فترة he escaped follow up. After 1 year he present with abdominal mass. The mass was at the near occupying part of the left hypochondrium and the lumbar region, which is a solid mass and is slightly tender. And I did ultrasound for him. This mass was compressing on the left ureter and producing hydronephrosis. And after investigation, this mass is diagnosed as retroperitoneal mass, lymph node enlargement, and recurrence. Also, you can palpate the organs, especially the liver, for any hepatomegaly, and the left supraclavicular lymph node, as I said. And these, you have to pay attention for these things if you suspect a tumor in the testis, if you feel a hard mass or a solid mass in the testis, and then you have to consider these things. This is an important table done by me. It's the differences between the epididymoarchitis and torsion, and it is clear. You have to take a history, physical examination, investigations, treatment, and complications. We have a great differences, a huge differences between the both conditions. Uh, what will you do by investigation? What is your approach? And imaging. You have to consider complete blood count, ESR, acute phase reactant proteins, general urine examination, urine culture and sensitivity, urethral swab for gram stain, culture and sensitivity. These, if you suspect epididymitis, epididymoarchitis with UTI, prostatitis. In case of tumor suspicion, you have to send the patient for tumor markers, alpha fetoprotein, lactate dehydrogenase, and human chorionic gonadotropin. Scrotal ultrasound is of great importance. Color Doppler ultrasound in case of torsion and varicocele, abdominal ultrasound, and you might need chest X-ray, chest CT, abdominal CT if you suspect a metastasis from testicular tumor. And the CT is with contrast, and if the patient has sensitivity to the contrast, then you can do an MRI. These pictures shows this one, it shows the uh, it shows the mass. It shows a mass here of the testis on ultrasound, and this is testicular mass tumor. Here, look, this is CT. There is a mass here. This is a retroperitoneal mass with enlargement of the lymph nodes. This is either metastasis or recurrence, and this is MRI with mass. Here is the dilated veins due to varicocele, and look for these veins, dilated veins. Yes, and this is usually we did the diagnosis of varicocele is clinical, but sometimes we need to do a color Doppler ultrasound for those with subclinical varicocele. مثل ما تعرفون الفاريكوسيل هو النورمال diameter of vein in the pampiniform plexus 0.5 to 1.5 millimeter. If it is larger than 2 millimeters, consider that varicocele. But sometimes it's very difficult to palpate a vein with 2 millimeters. That's why we need to do color Doppler ultrasound. This is scrotal ultrasound. Look for this is the testis, and this is a very huge hydrocele. This is a fluid. This is a fluid. Here is the color Doppler ultrasound in patient with left testicular torsion with decreased vascularity as compared with the right testis. This is an MCQ or most appropriate. A teenage boy presents with left testicular pain. Which of the following options need to be excluded first? Orchitis, epididymitis, torsion of the epididymal appendage, torsion, testicular tumor. Here the most important thing is testicular torsion. That's why the correct answer is testicular torsion. The second question, a 50-year-old man presents with dysuria, cloudy urine, so there is infection, and a tender swollen right testis. What is the most likely diagnosis? Because there is UTI and the swollen tender right testis, that's why we have to choose an orchitis.